Hello, I'm Michael Arthur, one of the spinal nurse advisors with PQSA.
And I'm Janine, Jaede, one of the other spinal nurses from PQSA.
We would like to acknowledge the traditional custodians of this country on which we meet and their continuing connection to land, sea and community. Today our colleagues meet on Kaurna, Larrakia, Aranda lands. We pay our respects to them and to elders past, present and emerging for their continuing culture and the contributions they make to our community. We extend that respect and acknowledgement to any Aboriginal and Torres Strait Islander peoples here today and those that are working to improve the outcomes for First Nations in closing the gap. Welcome to an introduction to sexuality and fertility after a spinal cord injury. What are the sexual function options post-spinal cord injury? After spinal cord injury, outcomes will depend on whether you are male or female, your spinal cord injury level, whether you have a complete or incomplete spinal cord injury, and whether you have reflexes present or not present. Let's have a quick review of the spinal cord, obviously emanating from the cord itself in the centre, with nerves out and about, running down towards the various parts of the body to control our functions and movements. And the levels of paralysis extend from the higher levels tetraplegia through to the low level paraplegia levels. Noting that in layman's terms, the explanation of the spinal cord actually finishes at the bottom of T12L1, the bottom of the ribs. This is important when we understand if we have reflexes or not. Medical terminology refers to the terms upper motor neurone and lower motor neurons and their function. Again, in layman's terms, reflexes are responsible for lots of our body functions, including the bladder, bowels, and of course, sexual responses. Upper motor neurons happen in the spinal cord and not in the nerves that run off from the spinal cord. As we can see from the next slide, the upper motor neurons run and operate from the spinal cord. These are the nerves that operate our reflexes. The nerves that run off the spinal cord and go to the muscles and the various organs, they are the lower motor neuron nerve fibres, and they when they're injured, do not release and have reflexes associated with them. So upper motor neuron lesions are within the spinal cord, control things automatically in our functions, and below that level, usually below the level of the ribs, the lower lumbar area, they're responsible for running off from the spinal cord itself and transmitting the messages backwards and forwards. And so if one of them is damaged, you don't have that reflex happening. The continuous circuit is not there for the spinal cord to make things work automatically. So what happens after a spinal cord injury? For women, female sexuality, sexual function and fertility, as a generalisation, again, there are no hard and fast rules, but as a generalisation, female fertility mechanisms are essentially unchanged, usually associated with the return of the normal menstrual cycle. However, we need to keep in mind as a caveat that always we need to assume that fertility is possible and assume that fertility is still there. As in the normal female population, the lack of an apparent menstrual cycle does not preclude fertility. So just because the woman doesn't have a normal menstrual cycle doesn't mean that she's not still fertile. So, and again, as a generalisation, female sexual function mechanisms may be altered, and sensory interpretation is also related to the areas of sensation and internal awareness. Tetraplegics and upper level paraplegics with reflexes intact, we talked before about upper motor neuron lesion, should be able to stimulate reflex, sexual, physical arousal and lubrication mechanisms after spinal cord injury. Again, referring back to whether you have reflexes or not having reflexes, this is one of those things that happens purely by reflex. Lower level paraplegics without reflexes, the lower motor neuron lesion, should be able to stimulate sexual mechanisms via the psychogenic or the mental stimulation pathway. Again, if a woman with a spinal cord injury is considering pregnancy, we need to seriously consider the possibility of autonomic dysreflexia during that pregnancy, and it will require specialist gynecologist and obstetrician management. but pregnancy is still nonetheless essentially an automatic function, so women can still proceed with a pregnancy with some oversight from specialists that are used to dealing with these, in particular the autonomic dysreflexia. Male sexual function after spinal cord injuries is different. As a generalisation, male fertility mechanisms are severely affected, again, in comparison to women. As a generalisation, male sexual function mechanisms may be altered. Sensory interpretation is related to areas of sensation and also to internal awareness. Tetraplegics and upper level paraplegics with reflexes intact, again, upper motor neuron lesion, should be able to obtain an erection from the physical stimulation pathway. Level paraplegics without intact reflexes, lower motor neuron lesion, should be able to obtain an erection via the psychogenic or the mental stimulation pathway. Again, these are generalisations. There are no hard and fast rules as such. In terms of erectile dysfunction management, there are things like intrapenile injections, penile implants, vacuum devices, medications that are inserted into the urethra, and also oral medications that can help with erectile dysfunction after spinal cord injury. For male sexual function fertility, as a generalisation, again, less than 10% of males will retain the ability to ejaculate and to therefore be fertile following spinal cord injury. As a generalisation, 10 to 14 days after spinal cord injury, there is a significant reduction in sperm motility, that is, the speed and the quality of movement of the sperm. However, the sperm numbers remain relatively normal. But again, we need to consider that always be aware that fertility is possible and should be assumed. As in the normal male population, even an apparent failure to ejaculate does not preclude a fertile emission. So you need to assume that you're fertile, not assume that you are not, even if there's no obvious ejaculation. There are a couple of methods which we can use if a man is not able to ejaculate normally after a spinal cord injury. The most common is the penile vibratory stimulation method with a couple of different devices. One is the Ferticare. Again, they use a vibration technique, and the device is placed against the skin of the end of the penis. And there's also the Vibrect mechanism, again, both using a vibration stimulation to obtain an ejaculation. Again, this is done without an erection. It's purely an ejaculation collection option. Some of the alternate methods are prostatic massage, electroejaculation, although that's quite an invasive procedure, and also surgical recovery by testicular sperm aspiration, inserting a needle into the testes to aspirate sperm. Don't be afraid to ask for information. The answers may be simpler and a lot easier than you think. There are answers.
And I'm going to talk about the sexuality side of things a little bit. Just going to touch on the tip of the iceberg here. So Sigmund Freud believed that the most powerful motivating force in humans was sex and procreation. And I got that from an online journal called Sex, Is It All in the Brain? Sometimes there isn't even a partner to talk to about sexuality, and that might seem a bit odd if you're a single person asking questions. And this is especially true in the context of people with a disability. Spinal cord injury in many ways affects the ability for an individual to engage in a sexually active life in the same way that they might have prior to their injury. But as a human being, you remain a sexual being despite your age, your injury or your illness. We're not here today to tell you what, when, why or how you should have sex. Rather, we're here to acknowledge you as a sexual being, and as such have a right to continue to be a sexual being, regardless of your spinal cord injury. The aim of the presentation today is just to open up some dialogue and help you navigate your way around finding supports. So just some nuts and bolts. Michael's already sort of given you a really good anatomy and physiology of the spinal cord and the sex organs after the spinal cord injury, so I won't go into that too much. But arousal can be psychogenic or reflexogenic, and so yes, it is in the brain. Sorry, my it's a bit husky. So yes, it is in the brain mostly. That's where you become aroused just by thinking or seeing, hearing, smelling, imagining something which is going to cause signals from your brain to travel to your genitals via the spinal cord. And reflexogenic, that can be arousal that's from touch or direct stimulation. When there is a spinal cord injury interrupting these pathways, those messages to the genitals are either distorted, incomplete, or absent in some people. So the type of spinal cord injury that you've got, whether it's complete or incomplete, and what level, will determine to some degree what kind of response you're going to have to both psychogenic and reflexogenic arousal. And just remember, no two people are the same. And even if they have the same injury at the same level, they're not going to experience the same effect from their spinal cord injury. Just as everyone has differences, such as their background, their gender, religion, politics, sexuality, knowledge and experience of sex, and preconceptions about how sex should look and feel like, everyone's experience is going to be different. So don't compare yourself to anybody else. So how do you find out what is physically possible for you after a spinal cord injury? Well, you get a lot of information, medical information from your rehab physician, so they can tell you things like what's generally going to be affected. But again, like Michael said, nothing's cut and dried, and everyone's going to present differently. The best way to find out is to experiment, try things out, see where you can feel, what feels good for you. Keep in mind, changes continue throughout your healing process and can be affected by things like medication and your general health and with normal aging. So, in the early days, while, you're at rehab, it's recovery and rehabilitation, that time of your life is really complex and can be really traumatising for people. And I think it's assumed by some that the last thing on your mind is sex when you're navigating, a world of wheelchairs and continence and such. But it has been found to be one of the highest priorities for people after spinal cord injury, along with bladder and bowel management. Sex is right up there. So, pardon the pun. So, I think it's really important that you think about what your goals are from having sex. In the past, what was your goal? Was it just to have an orgasm? Do you like to have sex or masturbate because it helps you sleep, for stress relief? Does it make you feel improve your self-esteem, your self-validation, or is it mainly to please your partner or to feel connected with your partner? You need to have open and honest communication and think about those things for yourself before you start navigating all the complexities. So, the 5 C's, are communication, compassion, curiosity, creativity, and collaboration. So communication with your partner, prospective partners, with the healthcare providers around you, and what is it you do or don't want to achieve from your sex life. Compassion, having understanding from your partner, understanding how your partner feels and what their desires are, and how to manage embarrassing situations. Curiosity, willingness to explore together or alone what your potential could be, how much you can feel physically and emotionally. Creativity, use your imagination and don't be afraid to try new things with your partner. For example, toys, visual aids, videos, you name it, it's not off the list. Collaboration, with Of course, your rehab specialists, your urologists, spinal nurses, sex therapists, GP, OT, even your adult shop assistant, assistive technology providers can give you advice. Personal support workers, you're going to need to collaborate with them sometimes, perhaps. And most importantly, with your partner. For people with arm function, touching can also be something you can do alone. In this presentation, or in his presentation, latest developments in spinal cord injury research, Dr. Ryan O'Hare-Doig from the Neil Saxey Centre stated that on functional MRI, it has been found that despite the individual having a complete spinal cord injury and no sensation below the lesion, there does continue to be brain activity in the area in response to touch. Research is continuing to this area, so watch this space. Don't discount the benefits of touching where there is no sensation. And kissing. What does kissing do psychologically? Well, along with oxytocin and dopamine that make you feel affection and euphoria, kissing, serotonin, other feel-good chemicals, it also lowers cortisol levels, so you feel more relaxed, making for a good time all around. A wise woman, one of our OTs, in fact, once said to me, never discount the effect of a good old pash. Spontaneity. Spontaneity could be or can be an issue for everyone at some point in their lives for biological reasons such as menopause, illness, age, medication to treat depression, social situations such as being a parent, single or separated, and psychological reasons such as depression, self-esteem and body image issues. Physical barriers, sometimes it's just the kid or the dog in the bed creating a barrier to spontaneity. Add spinal cord injury to all of those passion killers and considerations such as continence, medication, autonomic dysreflexia, and ability to physically move and feel, and you know, that is your passion killer. But don't, hang on, I've got a little bit more. Instead of seeing preparations for date night as a spontaneity killer, perhaps see it as anticipation, an exciting build-up to the evening ahead, something to look forward to. Therapy and counselling and psychology. Sometimes that you're just talking about it with your partner or with rehab specialists isn't helping, and your negative feelings and emotions are sometimes going to need some professional help to work out. I've found 3 sex therapists that are in Adelaide at the moment, and I've put the contact details for them. But please note that Selma Van Diest and Dr. Tudor are on extended leave until early 2023. But do contact the Heart Centre because there probably will be someone that can help. Some of the resources I've found in my research for this presentation, some of the assistive technology things, there's Bumpin, and I've put the link to that online for you to have a look at. The Intimate Rider, which is also a chair, like assistive technology chair that can help. Michael's already recommended a couple of things in his presentation. So somewhere you can shop. I've done some research in Black Knight Erotica on Kilkenny Road at Kilkenny. They're fully wheelchair accessible, and there's a car park at the back with accessible entry. So Push Mobility is also a resource for a provider for purchasing assistive technology. Some things to read: Sexuality Following Spinal Cord Injury. Touching Base is an organisation putting sex workers in touch with people with disabilities. And there's some other resources to listen to and to watch online with various topics of interest. And that's my presentation. So thank you for listening.
Thank you from us. There are always lots more options and levels of information available. Please feel comfortable to get in contact with the spinal nurses here at PQSA. We always have further information to give to people or directions that we can point you in. And as we've both said, the beginning is to ask, and then you can go to where you want to get to.
Yep, absolutely.
Thank you very much.
Okay, thanks.